Welcome. The U.S. House continues work on their budget, which includes drastic cuts to our healthcare, including slashing Medicaid and unrenewed subsidies for the Affordable Care Act. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, health policy expert Natasha Murphy talks about how the budget will affect your health care. Welcome, Natasha Murphy, Director of Health Policy at the Center for American Progress.
Hey, Laura, thanks so much for having me. Always a pleasure to chat with you and your audience.
Thanks. So let's start by there have been a lot of developments in Congress on a budget bill that will have drastic effects on American healthcare. So what is this bill and where's it at right now?
Yeah, so Laura, like you said, Congress has been busy making a lot of decisions that are truly going to reshape the American healthcare landscape, and not in a good way. So just last week, the House Energy and Commerce Committee, they held their markup for what amounts to the largest ever cut to the Medicaid program. So we are talking hundreds of billions of dollars, again, under the guise of fraud, waste, and abuse, trying to identify fiscal savings. But the reality is these proposed changes are going to do nothing but strip coverage away from people. And so while so many people were tuned in, and again, this was a markup that lasted for, 18 hours. So it was a very, very long day in which we heard from a variety of different lawmakers, touting the dangers of proposed cuts of this magnitude. And so where are we now? Just yesterday, so late on Sunday, the House Budget Committee voted to advance the kind of what's being dubbed now as the one big beautiful bill by the Trump administration. And that included these historic Medicaid cuts. And so as we look forward to the remainder of the week, on Wednesday, very early in the morning, right at 1 a.m., the House Rules Committee is set to meet. And we are going to see some additional changes and amendments to these already drastic cuts, with a floor vote expected by the end of the week. So these proposed changes are moving very rapidly throughout the halls of Congress. And it's really important that folks are activated and understand what exactly is currently being proposed.
So let's get to the why, because at the moment, they want to strip nearly $1 trillion out of our healthcare system, specifically Medicaid. But why are they taking this money? Because the analysis so far about the budget that's come out says that this does not reduce the deficit. In fact, it blows a giant hole in the deficit. So they are taking away healthcare from millions of Americans, and it's not even fixing the budget. Where's the money going?
No. And so that is honestly one of the most heinous and frustrating things. It is the fact that we are looking at historic Medicaid cuts that are going to impact children, low income people, mothers, people with disabilities, all to fund tax breaks for the top 1%. And so the concept of stripping away the safety net and really compromising how individuals who need the care get their coverage and care, all so that we can have, additional monies being funneled to the billionaires in this country.
For people that are listening or watching at home and don't have Medicaid, can you talk a little bit about how this will break rural hospitals and will affect everyone's healthcare in America if they succeed?
Yes, absolutely. Such a good point, Laura. So for, the 1 in 5, well, Medicaid covers about 1 in 5 Americans. So at one point, I feel like all of us either have been covered by Medicaid or know someone who has. But if you're not currently a Medicaid enrollee, I don't want you to think that this fight is not yours. As Laura mentioned, Medicaid is really a pillar and backbone of the U.S. health system and health landscape. Medicaid is the largest payer for things like behavioral health services. It pays for more than 4 in 10 births nationwide. And so it's really not, cuts to this program are not going to be isolated and just stay within, the Medicaid rolls. particularly as it relates to rural hospitals. Medicaid provides vital funding to these providers and to these hospitals and health systems. And these are areas where more often than not, so many of the patients that they see and serve every day are covered by Medicaid. So any type of cuts to the program that would increase the number of Americans who are uninsured is going to lead to more uncompensated care costs for these rural hospitals, so many of which are already on the brink of financial instability. And so if these Medicaid cuts pass through Congress and are implemented, we can anticipate to see pretty significant hospital closures in rural areas.
Now, Medicaid's their overhead rate, the rate of running the program is lower even than Medicare. So when elected officials say that these cuts won't hurt people on Medicaid, there just isn't the overhead to cut, right? Like cutting Medicaid means taking away health care from people because that's where the vast majority of the money is being spent.
That is correct. Yes, it's not like, we have these funds that you can snip away with. And to achieve the cuts of the magnitude that House Republicans are seeking, the only way to get there is by kicking people off of their coverage. And again, these are people who are eligible for Medicaid. I've seen a lot of talk around, this concept that, oh no, we're only removing those who are ineligible or folks who should have never been on the program in the first place. So there's been a lot of talk about undocumented folks or these, able-bodied people who refuse to get a job because, they have Medicaid coverage. And that's just not the reality. The fact is that, undocumented folks are not eligible for Medicaid in non-emergency situations. And then 92% of people on Medicaid or with Medicaid coverage are either working full or part-time. So a lot of the tropes that we're seeing out here are just false.
Mm-hmm. And the vast majority of people on Medicaid or are working or are caretaking or are pregnant or have disabilities and qualify under any circumstances. But they're planning to cut nearly $1 trillion from the program, and that means by definition they're going to get that much money on the system. They're going to have to remove healthcare from people that should have it by establishing paperwork requirements that make it hard for people to meet. So people who should have Medicaid will lose Medicaid simply because they're setting up a lot of red tape designed to make people lose Medicaid, right?
Yes, these unnecessary administrative and bureaucratic hurdles, like you mentioned, the paperwork requirements, they don't work. First off, they are designed to achieve savings only by removing eligible people from coverage because, these requirements actually, are more of a reporting structure as opposed to an actual work requirement. And so on its face, some people are like, oh, that sounds reasonable. But the reality is these are unnecessary barriers that require people to report on activities that honestly, many of them are already doing. But, if the state experience in places like Georgia have shown us that, these types of policies only achieve savings by kicking folks off coverage, and individuals really struggle with even attempting to comply with requirements like this.
Mm-hmm. And I think it's also interesting to look at DOGE went after the Department of Social Security, and they reduced the ability for people to get caseworkers, to get help if they had issues with Social Security. They, reduced phone support and so on. And all of this effort, which affected everybody that accesses Social Security, they found a fraud rate of less than 1%. So they made the system work worse for everybody to save pennies.
Exactly. And that's what is exceptionally frustrating about so much of, this framing around fraud, waste, and abuse and trying to get things to operate more effectively and efficiently. The actions are really in stark comparison and honestly the exact opposite of what they should be doing. If you were serious about tamping down on the fraud that exists in some of these programs, then you wouldn't be terminating the very investigators, who have the expertise to actually root out some of the bad actors.
Exactly. And if you care about abuse and waste, you look at the trillion dollars of overpayments to for profit insurance companies in Medicare Advantage instead of going after Medicaid, which is a very, very lean program that delivers health care to people who need it.
Yes, completely agree.
So, what can people do right now? Since we know Congress is working
Yes.
on a bill this week, what can we do about this if we have feelings?
Yes, absolutely. So, for all of the listeners, if you are listening and worried, you can take action now. I don't want you to think that this is all a done deal. This is a winnable fight. First things first, contact your member of Congress. If you or a loved one rely on the Medicaid program, speak up. It's personal stories that really change minds and influence policy. And so, whether that's reaching out to your member of Congress via phone or on social media, let them know that they need to have hands off Medicaid. They need to protect the program and the millions of Americans who rely on it. In addition to that, this week across the country, as well as here in DC, there are so many incredible nonprofit organizations, advocacy organizations that are hosting, virtual and in-person activations to help save Medicaid. And so I encourage you, if you can, to join either in person or online to make it clear to our representatives that they must oppose whatever bill, comes to the floor at the end of the week, reflecting the latest amendments. Overall, the more people speak up, the harder it is for our representatives to ignore us. And so healthcare, it's a right, not a privilege. And we have to make sure that we are doing our part to ensure that these budget cuts don't take that away.
And speaking of things that Congress is doing, let's talk about something Congress is not doing. So this budget bill, it cuts hundreds of billions of dollars from the Medicaid program. What it does not do is extend the Affordable Care Act subsidies that are expiring this year that make health insurance plans for middle class working families more affordable. And the scores that I've read say something like 5 million Americans will lose their health insurance plan because the prices are going to be unaffordable once these expire.
Yes, and that is, we're facing these dual affordability threats. The fact that yes, Congress is now so quick to act to strip millions from the Medicaid program, and like you said, that inaction as it relates to the enhanced tax credits in the ACA space. And I'm so glad you brought it up, Laura, because while we have rightly so been focused on defending Medicaid, there are also, a lot of things in this budget bill that are ACA sabotage and are very reminiscent of, the previous repeal and replace efforts that haven't received quite the same level of attention. But notably, Congress allowing these enhanced tax credits to expire is going to compromise affordability for, millions of Americans. Last count, you had more than 20 million folks who bought marketplace coverage who receive these tax credits, and they really, really make a difference in lowering premium affordability and has helped to drive, the historic marketplace enrollment that we've seen the past few years. And so, come September, when folks start to receive, their notices from their insurer, there's going to be significant sticker shock. And as a part of this broader affordability crisis, so many people are no longer going to be able to afford premiums and will have to drop coverage.
Absolutely. And this is personal to me because I'm a small business owner. My insurance is through the Affordable Care Act. I turn 50 next year, and that's when they really start increasing rates. So I could be squarely hit with a giant insurance bill next year.
Yes. And, in light of the fact that there are so few affordability options and, with these looming Medicaid cuts for folks who may lose Medicaid coverage and look to the ACA marketplaces as an alternative, the possibility of them being able to afford premiums, particularly once they go up upon expiration of these tax credits, is not very high. So it's just another way that coverage is going to be compromised because of, the actions of congressional Republicans.
Well, thanks for joining us, Natasha. We will keep an eye on the budget this week, and we will keep discussing it with our audience so that everyone knows what's at stake and how this will affect our healthcare.
Thanks so much for having me, Laura.
And now I'm pleased to introduce Louise Norris of healthinsurance.org to answer some of our viewer health insurance questions. Welcome, Louise.
Thanks, Laura. Great to be here.
And our first question, an email from a reader. At my last job, I was paying about $450 a month for health insurance for myself, my wife, and our son. I recently changed jobs, and while the coverage at my new job is good, the insurance cost is now $700 every 2 weeks. So so this person's gone from $450 a month to $1,400 a month. Does this sound correct, or like there might be some kind of an error?
So this is just an example of how health insurance coverage from employers really varies in terms of what you pay for your coverage. The average total price of employer-sponsored family health insurance is actually over $2,100 a month, and that's an average. You mentioned that your coverage is good. You consider it to be good, so it might be on the even higher than the average in terms of total premiums. But a lot of folks aren't aware of what their total premiums are because employers pay part of the bill and the employee pays part of the bill. It sounds like at your previous job, the employer was paying the lion's share of the bill if you were only paying $450 for family coverage per month. So $1,400 for family coverage is certainly within the realm of reason. I mean, anytime you suspect that there might be an error, you should obviously contact Human Resources and make sure that what's being deducted on your check is correct, but it's certainly not out of the ordinary to have a $1,400 a month bill for family health insurance. It is possible, depending on how much of that is for your family versus how much is for yourself, it's possible that your wife and son might qualify for subsidies in the marketplace instead of accepting that employer's offer. But that very much depends on how much their premiums are versus your total household income. We do have a calculator on healthinsurance.org that's an employer coverage affordability calculator. You can also just go to healthcare.gov, and if your state doesn't use healthcare.gov, it will direct you to the correct state marketplace page, and talk to them about whether your family members might qualify for a subsidy. But in most cases, it ends up working out better for folks to just keep the family altogether on the employer's plan, because then you get one family maximum out of pocket. And like you said, the coverage itself is good. So your mileage will vary. You just have to look at what's available outside of the employer's plan and compare it with what you're getting from the employer. But your coverage is certainly within the realm of normal.
Thanks, Louise. Our next question is an email from Jana, who says that I'm having a lot of problems with my insurance at the moment. They paid claims and then went back and denied them going back to 2022, so 3 years ago. It was partially my fault because I was misinformed on my primary versus secondary coverage, and I misinformed my providers, of which were Switch. I straightened it out with both of my providers. However, some providers are unable to refile claims going all the way back to 2022, and it's a big nightmare. One provider refuses to see me. In all, it's about $10,000 or more worth of claims that I'm now being billed for. Louise, do you have any thoughts for what Jana can do?
Yeah, this is a tough one. So basically, it sounds like in this situation, the patient wasn't aware which insurance was primary and which was secondary. And so it sounds like gave the provider the secondary insurance to bill first. And then they billed them, the insurance paid it, and then found out after the fact that there was, in fact, a different primary insurance. So in a situation like that, the insurer that paid as primary when they were actually supposed to be secondary can just go back and deny all the claims and basically tell you the provider has to refile these claims through the primary insurance first. Then after the primary insurance has processed the claims and paid, then the claims can be again refiled through the secondary insurance. So once it's all said and done, theoretically, it should work out where both insurers are paying their share. But this one does sound tricky since we're going back 3 years. It's possible that the providers that are struggling, you said some of the providers aren't refiling. It's possible they have a new claims system. Their legacy system might no longer be available for them to access. You can contact the insurance department in your state to see if they have any guidance or if they can get involved on your behalf. You can also request to set up a three-way call with the provider's office and the health plan that's supposed to be primary to see how they can go about unearthing this claim from 3 years ago and filing it through the proper channels. Unfortunately, this just might take a while and be, a bit of a pain of a process to go through. So don't give up. Just keep calling people and talking to them and asking them to refile this.
Good luck, Jana. Our next question is from Kay Peterson, who asks, will seniors with pre-existing conditions get booted off their insurance? And I think what Kay is talking about perhaps is what we've been talking about on several of these shows, which is the possible Medicaid cuts and other healthcare cuts in the budget bill. So nothing has been signed into law. First of all, nothing's been signed into law yet. So no changes have been made yet. And even if it were to be signed into law, I believe that this would be for next year and not this year. So you're not at immediate risk of losing health insurance right now. But Louise, do you want to talk a little bit about when changes will take effect if some drastic changes do go through?
Yeah, and some of this is, as Natasha was talking about, like spread out over time. Like these aren't even necessarily changes that would take effect in 2026, all of them. Some of them are pushed out into 2027 or a future year. And it's when, this person's asking about seniors with pre-existing conditions. Most seniors are on Medicare, but it's really important to understand that Medicaid, which is the target of these cuts in the budget bill, Medicaid covers almost 13 million people who also have Medicare. So if you are low income, if you're a low income senior with very little in the way of income or assets, you can qualify for both. And in that case, Medicaid is picking up like your out-of-pocket costs and your premiums under Medicare, making your coverage more affordable. Medicaid is also covering things like nursing home care, which Medicare does not cover at all. So for low-income seniors, Medicaid is really important. And it's not specifically people with pre-existing conditions. These cuts are across the board. If there are funding cuts, some people who will lose their coverage will have pre-existing conditions, others won't. It's not, it's just funding cuts, which means millions of people lose their Medicaid. So that is, again, why it's so important to be reaching out to your lawmakers. If you are relying on Medicaid in addition to Medicare as a low-income senior, or if you have a loved one who is, this is really important to be paying attention and reaching out about this. The nursing home issue is a big deal. Almost 2/3 of nursing home residents in the United States have Medicaid as their primary payer for their nursing home coverage, because again, Medicare does not cover that. So if you are on Medicaid or have a loved one who's on Medicaid in a nursing home, that is, budget cuts to Medicaid could certainly affect that.
Absolutely. And our next question is from L. Rudiman, who says that health insurance is not healthcare. Today, I found out that my pharmacy benefits manager is dropping Humira from the formulary on July 1st. The one drug that changed my life is gone. They want me to switch to a biosimilar, not a generic, not identical, just close enough. Cheaper, but doesn't always work the same. So my choices are to appeal and hope, try the biosimilar and possibly fail, switch to another brand, or pay $4,000 a month out of pocket in addition to my insurance. Louise?
Yeah, unfortunately, that does sum up a lot of what the options are here. You're not alone. There have been other pharmacy benefit managers that have been dropping Humira off their formulary and instead switching to these biosimilars. If your doctor doesn't think that this would work for you, you can certainly file an appeal, and your doctor is your partner in that. They will help you through the appeals process with your health plan. It's also worth noting that Humira does have a patient assistance program. You can access it through their website or their app. There are various eligibility requirements to qualify for help through a patient assistance program, like income requirements and what your health coverage is. But depending on whether you qualify, those can really help a lot with the out-of-pocket costs if your health plan doesn't cover the drug.
Thanks, Louise. Our next question is from Texan Flower, who says, about March of last year, I checked my claims on my health insurance and noticed one for a $25,000 surgery that was pending, a surgery that took place in Denver. I had not had surgery for 7 years at that point, and I live in Dallas, not Denver. I contacted my insurance company and they got it taken off my claims. But then this weekend, I noticed that the surgery charge had reappeared on my claims and was approved, and I owed $1,400. Apparently, on that day, a man with my exact name and born on the same day as me had the procedure done. None of this explained why they used my insurance, but whatever. It's off my claims for now, and I don't owe anything. But this is hopefully this is the last time I have to fight this. So, how often does this happen where same or similar name people get confused by the system and people get billed for medical procedures that are not theirs? And what do you do about it? Louise?
Yeah, so this is, I mean, it's not common, but it's certainly not unheard of. If you have the same name as someone else, and especially if you have the same birthday and name, it's easy. It can just be human error where a person in the either the reception office when you arrive at the appointment or in the billing office just selects the wrong name on a list. So human error can certainly happen. There can be tech glitches that can make stuff like this happen. This is why it's so important to pay attention to those explanation of benefit forms that you get from your health plan, or if you're on Medicare, it's a quarterly report that's called the Medicare Summary Notice. Don't just stick those in a drawer. Make sure you open it, look at it, and make sure you got all the services that are being listed, because mistakes do happen. Fraud also does happen. Again, not widespread, not common, but it does happen where services will be billed that never actually happened. So again, you can catch this by reading those explanation of benefit forms. And it sounds like in this case, they did identify that the cause was another person with the same name, and it just got erroneously attributed to that person. The surgery got attributed to the wrong person, and it did get sorted out. So you can find it and you can get it sorted out as long as you are paying attention to those notices that you're getting. Don't pay a medical bill unless it matches what's on the explanation of benefits. If you get a medical bill from a provider's office and you haven't had an explanation of benefits from your health plan saying that you owe the same amount of money that provider is billing, hold off on paying the bill. Make sure you contact your health plan, contact the provider's office, and make sure that everyone is in agreement on how much you owe before you actually send any money.
Thank you, Louise. And thank you, everybody, for joining us today to learn more about federal budget and potential cuts to our healthcare. Please text or call in your health insurance and healthcare questions to 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.